Post-traumatic stress disorder. This is what I'm going to talk to you about, and it is a very real condition, and some people don't know it until they're right in it. But the kind I'm going to tell you about is the non-military. Okay, so it is post, which means the symptoms show up after an event, after something that was very upsetting, and it can be post, or it can also be during the experience itself. It can be right away, and in a situation where there's abuse that's been ongoing, it can just build up over time and get worse. So when it isn't war induced, post-traumatic stress disorder can be from things like rape, to very bad accidents, having someone close to you killed suddenly, witnessing a horrifying event, children that had been sexually abused when they were young may find that they grow up to take on a lot of these symptoms, which is a sign that they need to work through the pain of their experiences. So could be car accidents, could be any natural disasters, and that kind of thing. So it's happened, and the thing is what do we do? Now we're in the post part of it, and we're also in the traumatic part. The traumatic part is where we get some of the scariest, most frightening symptoms to deal with. A lot of anxiety, feeling on edge all the time, lots of fear, fearing places that are very safe, insomnia, affects many areas of our life, socially, work, etc. And we may get depression. So the depression has got, another spectrum of anywhere of 8 to 10 symptoms. You may have some, but hopefully not all. Re-experiencing and flashbacks. That's when you get triggered, and then all of a sudden you feel like you're right back in that event, right back beside that person, or witnessing, or hearing, or sounds, colors, everything. So that's why they call them flashbacks. And they can throw us into a dissociation where we just can't focus, we can't concentrate on the moment, because the experience gets so intense that it's difficult to do. Hyper-arousal, because our nerves are on edge so much, a loud noise or whatever can set us off again and be like another trigger. We might avoid certain places because it reminds us of other things that connect in our mind to the event. Anxiety can get pretty intense. Deep breathing is useful. Writing things out in a journal, talking to a counselor, because we are in the traumatic part of this. Means we can benefit very, very much from trauma counseling, and that is one way to get out. So stress hooks in with the anxiety. You need to start learning how to manage that, and it will take time. And D is for disorder, and we'll be happy when we do get it all in order. We will. It just takes time. Insomnia. It's okay to get something to help you sleep temporarily. It worked for me. It stopped my nightmares so that I could sleep through without having nightmares. And we're all different, but just remember the traumatic part and seek trauma counseling. And if you're going through it and need help or whatever, please leave a question at the bottom and I'll be sure to get back to you. And I'll be doing more videos, so it'd be great if you'd subscribe, and we'll see you soon.